I think I have met everybody except for Taylor Jane. Sorry, I don't know how to say your last name.
That's okay. No one ever does. It's Veriwick. I'm with the Amani Center.
Oh, great. Awesome. Thank you. Thanks for being here. Okay. Well, I'm Christy. I'm part of the System of Care Advisory Council team, and primary administrator on the System of Care grants. All right, so let's dig in. I've got some slides. We are going to talk about the next round of funding, so the 25 to 27 System of Care grants offered by the System of Care Advisory Council. Boy, sorry, everybody. I have to like manually let people in the room. Okay. That's what I'm looking for. Okay. So today we'll talk about the funding categories for 25 to 27, kind of give you a better sense of, kind of types of desired activities that we're thinking you would implement. We'll talk a little bit about the timeline and the amendment process and answer all of your questions. So please feel free to interrupt me as we move through these slides. Really want to make sure you get all of your questions answered. The way that I'm looking at my screen, I unfortunately cannot see anybody's faces while these slides are up. So if someone could just like help me out here, just shout it out or let me know when there's a comment or a hand raised, that would be really great.
You got it.
Thanks, Haley. All right, so purpose of System of Care regional grants, no changes here. These are exactly the same points from the 23 to 25 grants. We're hoping you use these dollars to increase meaningful and equitable family and youth involvement in your local systems of care. We hope you use these funds to advance equity and decrease disproportionality within the system, especially for children and youth of color. We hope you use these funds to support your local system of care collaboratives or your governance structures, applying system of care values and principles. And then finally, we hope that you make data-driven decisions along the way. By the end of 2027, here are some of the outcomes that we hope you will achieve. The first is that youth and family members will be centered in decision-making within your system, that equitable outcomes will be achieved, that system of care values and principles will be applied throughout the system, and that local systems of care will be utilizing both quantitative and qualitative data. Who is eligible for funding? So again, System of Care Advisory Council is offering non-competitive $200,000 grants to the 14 regions. These dollars can go directly to coordinated care organizations or to community-based organizations that have letters of endorsement from System of Care Executive Council and or the CCOs in the region. So no changes in who's eligible for funding. If you are a CBO and are not sure if your organization is going to be applying, again, like please let me know. Similarly, if you are a CCO grantee but are thinking about maybe moving that money to a CBO in your region, like please let me know so we can have a conversation about that. Does anybody know? I'm just going to ask. Is anybody thinking about changing who's receiving funding in your region?
I don't think we know yet in our area, right?
Okay.
Like I'm yeah, not sure.
Okay. All right. So maybe you're not sure, maybe you don't anticipate any changes. Okay, Danny, you're going to use, yeah. I mean, many of you like sub-grant out, and that's fine. We're just talking about who would, if there's going to be any changes in like the primary grantee within your region. Okay, just, yeah, let me know if you anticipate a change in your region, like that will be like a little bit of a different conversation. So the sooner you know, or sooner you're thinking about that, even just like let me know and we can have a conversation about it. Okay, moving on. Okay, so funding categories, again, no changes here. We provide these categories to you not to like, not to create a barrier or like rigidity within how you spend these funds. It's really so that at a state level, we have a better understanding of where these dollars are going. So it's kind of like an organizational structure. If you have an idea in your mind that you want to fund and you don't see where it would fit into one of these funding categories, like just reach out. We can have a conversation. I'd be really surprised if there's something you wanted to do that we couldn't kind of figure out where to spend or, how to categorize it. So please don't let that be a barrier. New this year, youth and family engagement and diversity, equity, and inclusion, you're still going to be required to put some funding to those categories. Change here in 25 to 27, we're also going to ask you to put money towards strategic planning and implementation. So there's 3 categories where we have required allocation, and I'm going to talk a little bit more about what that will look like. Okay, so getting into the details, I'm going to share a little bit more about the purpose and some example activities within each of these categories. Again, these are not like specific, you must have to do these things. It's really just to give you an idea of what either current grantees are spending on, what you could be spending on. Again, these are not have-tos. These are just kind of providing some illustration about what this work could look like. So the first one, youth and family engagement. This is a required funding category. The purpose here is to advance co-creation and shared decision-making with youth and family members in your regional system. Examples of what this funding could be spent on is things like stipends, so paying people to participate and provide input into your system. If you're convening people in person, this could be spending things on food, transportation, childcare. For virtual meetings, this could be helping people with technology support, so buying tablets, helping pay for Wi-Fi, those kinds of things. You can use these funds to bring on dedicated youth and family engagement staff and/or contractors. You can use this funding to leverage existing youth and family councils in your region. So maybe you don't need to set up a whole new thing for system of care. Maybe you just want to partner or leverage existing youth and family councils in your region. You can use this funding for that. You can also use this funding to support leadership development. So providing access to conferences and trainings for your youth and family members, helping them build their capacity in leadership within your system. Any questions here about this category? Okay, moving on. The next category, diversity, equity, and inclusion. Again, this is a required category. We really see DEI work as being kind of the second side of the family and youth engagement coin, right? If we're going to do system of care, we need both family and youth engagement. We also need to make sure that youth and family are representing diverse communities and experiences. So this work is really intended to advance equity, inclusion, sense of belonging among groups most impacted by system inequities. So for example, Black, Indigenous, Native youth, immigrant refugee youth, LGBTQIA youth, etc. The SOCAC does lead with race in our equity work, so encourage you to think about within your region how you might do that. And every community is a little bit different. So again, just really encourage you to look at your data to understand within your region, within your county, who's experiencing the most inequities, who's most harmed by systems, and that will hopefully tell you which community groups within your region to direct some of this funding to. What this could look like, again, some examples of how money is currently being spent, how it could be spent moving forward. Community partner outreach and development. So this could look like looking to culturally and linguistically responsive community-based organizations in your region, doing some outreach, leveraging their expertise in bringing communities into this work. You could use funds to hire dedicated DEI staff and/or contractors. Some of you have been using this funding to bring in training or other technical assistance to your region. You could use this funding to analyze disaggregated data. Maybe you really just don't know within your region which communities are most harmed by systems or are most overrepresented. So you can use some of this funding to look at more data. You could use this funding to identify and use racial equity tools. So again, for example, SOCAC has a racial equity toolkit that we adopted through the Government Alliance on Race and Equity. There are many, many, many tools out there that you could use and adopt to meet your region's needs. A lot of you use this funding for translation and interpretation services. Again, culturally and linguistically responsive services is a core value, so you can use money for that. And or other specific culturally and linguistically responsive interventions for priority populations that you've identified within your region. So for example, some of you are standing up parent cafes that are conducted solely in Spanish, as an example. Let me pause here and see if there's any questions about this particular category. Okay. All right, next one, strategic planning and implementation. So this is the new required category, and I know there's been a lot of confusion and question about what this means, so hopefully this will help clarify that. As you all know, System of Care Advisory Council this year is going to be developing a new System of Care strategic plan due to the legislature January of 26. That plan will outline the work that we need to do collectively over the next 4 years. And we hope that regional systems of care will be an important implementation partner in that work. This is a little bit confusing, I know, because the CCO contract mentions strategic planning, but it's not super explicit. The direct quote, and I pulled it out here, in the CCO contract reads, quote, "The advisory committee shall advise on policy development, implementation, and provide oversight using a strategic plan," unquote. So again, there's no further explicit direction or guidance that OHA provides to regional systems of care. And so as SOCAC, it's a little bit unclear to us kind of who has a strategic plan regionally, what does that look like? We've asked and invited you all to send in your strategic plans if you have them. Very few folks have shared a strategic plan for your region. So our assumption is that most of you probably don't have one. So again, it's a little bit confusing from the CCO contract. So that being said, as we look to a new strategic plan, we do anticipate that regional systems will have a role in helping to implement those identified strategies. There's lots of ways where you will be invited and engaged in the strategic planning process this year. So I'm hopeful that whatever we produce at the state will be meaningful to you, or you will be able to see the work of your region, the priorities of your region within that plan. The specifics of that are yet to be determined, right? So what we hope here is that you'll set aside some funding to support implementation of that plan, acknowledging that the funding, the 25 to 27 funding is going to take you through all of 26 and all of 27. So 2 out of the next 4 years of implementation. So exactly what that could look like. This could be as simple as convening a community event in your region whereby you help to socialize and engage your local community in the state plan. It could also look like developing or revising a plan that you already have in alignment with the new plan. It could look like engaging community in development of a strategic plan locally if you don't already have one. It could look like creating some sort of action plan, again, in alignment with the state plan. It could look like sustainability planning. Again, kind of up to you all to kind of figure out, and depending on where your region is in the world of strategic planning, kind of what this looks like. But it doesn't have to be huge. It doesn't have to be this whole new deliverable. It's really an opportunity for you all to have some funding, some resource to help us lift up this next strategic plan.
Hey, Christy, Danny's got a question in the chat, and then Amanda.
Yes. Let me actually pull my slides down or at least stop sharing, because I anticipate you wanted to talk about this one. Okay, I can see you.
Go ahead, Danny. Or do you want me to just read your question since I'm already off mute? Danny put in the chat, these required categories, will they require a dollar amount, or will they be a required dollar amount that we have to dedicate to them?
No required amount. No.
So in that slide, my question, Chrissy, was in the slide that you just had up at the top. It said the purpose was alignment with the 26 to 29 SOC strategic plan, which is a little for the way my local system of care talks and thinks, that might be a little misleading for folks, because when you were speaking, what I heard you say is in alignment with the 26-29 SOCAC strategic plan instead of SOC. Is that
interesting?
Is that incorrect? An incorrect interpretation, I guess, because when my folks will read SOC, they'll think of themselves, the local SOC, not.
Yeah, it's interesting, right? Like the language we use and how it means different things.
Yep. That's why I just wanted to check, and if I need to clarify for them, because I bet that question will come up for us.
Yeah. Yes, it is referring to the SOCAC strategic plan for the system of care. But that when just in terms of like where that comes from in my mind, right? SOCAC is a council, like the council is charged with creating a statewide system of care strategic plan. So the plan will be statewide. SOCAC will take the lead on developing it, but the application of it will be for the entire state, with regional system of care partners being an important partner in implementing the activities.
Got it. So these dollars specifically, like if we were reworking our own strategic plan, we could only use these dollars to rework that strategic plan if we were aligning our local strategic plan with the SOCAC.
No, you don't have to. No. If you have a strategic plan and you want to put some money towards it, awesome. Even better if it's aligned. Better if it's aligned with whatever this next plan will look like. Again,
I imagine it will, because we all are on the same team and doing very similar work. But I know when I brought this up at our last local committee meeting, there were lots of questions. And I was like, I haven't been to the meeting yet. I can't answer all of these. Because our strategic plan needs work. And so we're entering into a season where we want to rework it, because we have a lot of new engagement and those voices aren't reflected in our strategic plan.
Awesome. That's great.
Okay.
And you got some money to do it. Does that answer
money
all your...
to do it?
Yeah.
I think so. Yeah, I think so.
Okay.
Thank you. Oh, wait, it was already down. Put it back down.
Danny, you had a hand up for a second. Okay. Any other questions on the strategic planning piece? Okay. Feel free if something comes up. Okay. Back to it. Okay. Next category is resolving local gaps and barriers. Again, this is really about addressing service gaps, service barriers in your system. It doesn't necessarily have to address specific barriers that have been like addressed through your formal process. Barriers here is much more broad, right? It just really means kind of anything that's creating a challenge within your region. So lots of examples here. From how current grants are being spent, this could look like hiring subject-specific consultants and or staff time to conduct data and policy analysis on a specific issue. So top of mind here is Jackson System of Care is doing some work on chronic absenteeism, and they've brought on a consultant to do some research on that. You could use this money to start up a youth drop-in center in your region, to sponsor respite activities or after school, out of school activities. A lot of you using these funds for that kind of work. You could use this funding to hire staff. So shout out to the Columbia Gorge System of Care, who's using these funds to bring in qualified mental health professionals into schools. Such a cool opportunity to expand a really needed service. You could use these funds to, provide youth outreach workers, help leverage peer supports in your region, training and education for families and community members. So just examples, Lynn Lincoln Benton System of Care has provided some training to families on how to work and support young people who have aggressive behaviors. As an example, you could use funds to launch a mobile app. It's another project that these funds have been used for. Supporting youth in temporary housing. You could distribute supplies through mobile resource hubs, really cool work for rural areas in particular. Install or improve quiet rooms in area high schools. That's something the Tri-County System of Care is doing in partnership with a youth council. Purchasing medication lock boxes. The list goes on and on and on. Lots of different ways. Does that, I'll pause here, see if there's any questions about this work. Okay. Hearing none, we'll keep moving. Okay, supporting a system of care collaborative or your governance structure. This is really kind of any funding that's used to support the meeting of people, right? Executive committee, advisory council, practice level work groups. Maybe you call them something else in your region, but generally you're bringing people together. So you could support these groups with a variety of different ways. So some of you are bringing in education and training. So this would be stuff that isn't like a training that isn't like DEI specific, where that we would put in the DEI category. This might be training on collective impact principles or, something else kind of more universal. Community engagement and connection, again, kind of going out into community and developing partnership with folks. You can use these funds for admin, supervisory support, staffing supports, consultants. If you're bringing people together in person, maybe you have an annual meeting or an annual summit. You can use this to pay for food, for transportation, for the venue, meeting facilitation, etc. Any questions on this category? Okay. Agile funding. So this is, I think, our third round of using these funds for agile funding. So I think most people are pretty familiar with these dollars. But these are meant to meet emergent social needs of system-involved children, youth, and families. So these are very similar to flex funds through health-related services or health-related social needs. These are direct payments to individual youth or families. The definitions of these funds is more flexible than flex funds, the HRS flex funds, and they don't have to meet Medicaid definitions. Again, these dollars are entirely state funded, so they're very, very flexible. I think the word of caution here, as those who are implementing these dollars would tell you, is that it can be administratively burdensome. So most regions do contract the distribution of these funds out to community partners like a United Way or a school district. Some regions are leveraging these dollars to leverage additional child welfare family preservation dollars, which is really cool. If you have family preservation pilots in your region, you might want to explore that. 8 regions, so 8 out of the 14 system of care regions have allocated agile funding in the 23 to 25 biennium. So, not everybody's doing this. It takes some, I think, thinking and planning, but it definitely is a very impactful service when it's used. Again, really flexible. We see most of these dollars being used to support things like housing and utility assistance, transportation, access to family-friendly events. There's a whole kind of list of kind of approved dollars. But again, these are really flexible. There really isn't any sort of like rigid definition of what is and isn't allowed. That's really up for your region to decide. Any questions here? Okay, if you have not been distributing agile funding, but are considering it, again, like happy to talk. It might be something you want to talk with other regions about who are distributing it, just so you have kind of a sense of what's involved. The reporting on this is a little bit different because we do require you to report kind of specific numbers of families served and the dollar amount. So that's something also to consider. Okay. Communication outreach and social media. Again, these funds are meant to be used to socialize and promote your system of care throughout your region. So you might have a website that you're paying for. You might have membership or subscriptions to things like Basecamp, Slack, kind of other online organizing websites. You might have social media campaigns. Maybe you're buying advertising on those platforms, promotional campaigns, advertising, printed materials, swag, kind of anything that helps to get communication out about your region. Any questions about that? Okay. And then finally, indirect cost. So includes things like office supplies, equipment, utilities, computers. The cap on this for CCOs is 10%, so no more than 10% of your grant can go towards indirect if you are a CCO applying. If you are a CBO, a community-based organization, the indirect is 20%. Any questions about the indirect? Okay, so the big question, how much should we allocate? Again, there's no minimum for any of these categories. So ultimately, it's really up to you all and your regional partners about where and how much you want to allocate funding. But just to give you a sense of where the 23 to 25 grant dollars were used for, I put together this very mediocre pie chart. Which shows you that about half of the funding went to youth and family engagement and addressing barriers. So about a quarter to youth and family, a quarter to addressing local barriers, only 15% to DEI, about a fifth to agile funding, and then just a little bit of money comparatively going to support for your system of care collaborative or governance structures, to communication, 5% going to indirect, and 0%. So there were no dollars allocated to strategic planning in the last round. Again, I'm really curious to see what you all do with those funds, not that that is a required category. So this, in no way should kind of, hold you to anything, but just gives you a sense of overall kind of where do we see other dollars going. All right, so timeline. So the whole goal here is we are trying to get these grants, the grant amendment executed before the current grant ends. So your current grant ends December of 2025. We're trying to get everything signed and wrapped up by the end of the year. So we let you all know these funds were available last month. We have asked you to submit a new implementation plan by June 30th. That will give us July and August for SOCAC and members of the SOCAC Grants Committee to review your proposed amendments, kind of negotiate if there's anything in there that we have question about. As soon as we get the dollars from the state legislature, hopefully by August, we will then kind of start routing all of this paperwork through the Office of Contracts and Procurement. Sometimes that goes quickly, sometimes it doesn't. Sometimes we need to go through Department of Justice for approval. But anyways, that can take some time. But we're hoping then that we would have all of those documents executed by end of the year with a start date of January 2026 and an end date of December 2027. Any questions about the timeline? Okay. Grant requirements. So we are going to continue to require attendance at the quarterly grantee learning collaborative. That's 4 times a year. It's an opportunity to kind of check in about your grant, share with other regions, kind of what's working, what's not working, hopefully provide some peer-based technical assistance. On your reporting, we're going to decrease. So instead of quarterly reports, we're going to take that down to only requiring reports every 6 months. So reports 2 times a year. Don't anticipate that much of those reports would change. So it's kind of similar template in terms of what did you accomplish? What are your challenges? Where are you using your funds? What recommendations do you have? So no changes there, albeit hopefully a little bit less administrative burden for you all. And in return, we're going to require something new, which is that all regions will participate in a system of care infrastructure survey. And I've got a little bit more information about that on the next couple of slides. But before I advance, are there any questions about this slide?
Hey, Christy, are you going to speak at all to what the implementation plan requirements will be, like what the paperwork is going to be? Okay.
Yeah. And I've got like a template for you, but basically it will be, the implementation table that's in your current grant agreement. It's basically going to be like that. It's going to be like, here are the funding categories. How much do you want to put towards each of those categories? What activities are you going to do with that money? What are your hoped for outcomes? So you will have to give us some like SMART objectives. And I have some examples of those. If you know who your sub-grantees are going to be, great. Let us know that. If you don't know, that's okay too. So it'll basically be just like redo the table. So trying to keep it kind of as easy as possible for you all.
Thanks.
Okay, great question. Okay. So a little bit more about this survey. So for those who participated in the system reform support instrument that was brought to you by our friends at University of Connecticut, this is trying to get at the same impact as that tool, or the same intent rather, while addressing some of the challenges. That tool was like very complicated, overly complicated for many. And to that end, it's really hard to know like what to do with all of that information. So this survey that we've identified is similar in terms of like the types of questions, the type of data that it's trying to collect, but hopefully it's much more accessible. The other big limitation we had with the system reform support instrument is that it was an opt-in. So not all regions participated. I think only like half of our regions participated. It makes it really hard to get data that's valid across the state. And so particularly as we look to a new strategic plan and measures for monitoring our progress and implementing that plan, it's really, really important that we have a valid data source that tells us something about the infrastructure for our system of care. And right now we really don't have anything. So this tool that you are all going to be required to participate in, assuming you want these dollars, it's modeled off of a national tool that was developed by the National Training and Technical Assistance Center. I'm happy to provide you a link to the tool that they have. We are going to modify it so that, won't change a ton, but some of the questions and things, we've gotten some feedback from some of you who have looked at this tool that, there are some changes we might want to make. We're going to do that. Again, it's going to provide valuable data for monitoring implementation of the state system of care strategic plan. We also hope that it helps provide comparable information for your region as well. You'll be able to see, you'll get your region's results. You'll get to see areas of strength, areas of opportunity within your region. You'll be able to compare that to the other regions in the state. So again, data for us, data for you. It will be an online survey. SOCAC is going to take on the burden of building that survey into SurveyMonkey or whatever it is we use. Your responsibility as a region is to convene system partners to respond. And we're looking for a minimum of 10 survey respondents per region. So hopefully not a major lift. And according to the tool that we have with us, this estimated response time is 20 minutes. So you're looking for 10 people to give you 20 minutes one time throughout the duration of the 2-year grant. We're not doing this every year. We're going to do it once during the grant. So hopefully this isn't a huge lift. And hopefully the benefit of the data that you get is going to greatly outweigh any kind of concerns or hesitations you have about it. The survey will explore 5 areas of implementation of the system of care. So it'll be looking at things like, do you have a plan for the approach? What does your service delivery look like? What services and supports are available? What does the system infrastructure look like? What is the strength of that infrastructure? How committed is the region to this philosophy and approach? Again, this will be a partnership, so SOCAC will engage and invite you all to participate in kind of getting this tool in a place that is ready for the regions and relevant to Oregon's system. You'll also be able to help participate in analysis if you want and kind of, reacting to and making sense of the data. So I hope you're excited about it. I'm super excited about it. Timeline wise, I don't think we've totally figured it out yet. Maybe sometime in 2026 we'll start looking at this. I don't think we'll have real rigid timelines of when you all need to complete it. And again, I don't anticipate it's going to be a big lift. So any questions or concerns about that as of now?
Can you talk a little bit about like what SOCAC will be doing with that information, or like what the plan is a little long term? Because I mean, I'm less concerned about the content. Obviously, we did the SRSI and it was a lot, but it was kind of best practice, so we rolled it out. But so I trust the content, but it's hard to pivot every few years. Like if we're just going to survey the group every few years, that's something different than using the information that we're surveying and using it consistently between SOCAC and the regions. If that makes sense.
Yeah, that's a great question, Lana. I know for sure that the data committee will be looking at this survey when we identify, we're identifying measures for the next for the next strategic plan, looking both at outcome measures and process measures. So hoping to see that some of this data that we collect will be used as part of that measure set. So at a state level, we'll be using the data to see how we're doing. I do anticipate that this is something that we would, that this is a tool that we would use regularly, right? Maybe every 2 years we roll it out so we can actually measure progress over time and hopefully see improvements over time across the region. So I don't think we've explicitly said that, but that is at least, I think, my hope and hope, from Andrew and some members of the data committee as well.
Okay, thank you.
Any other questions about the survey?
Yeah, Chrissy, I'm imagining that we'll want youth and family to participate, right?
Okay. Yeah.
I mean, the SRSI, they separated it. Our youth did like this kind of focus group, right? And then everybody else did this, whatever that was. And even that, like the actual SRSI, it was just so confusing the way things were asked and things like that. So I'm sure y'all are already thinking of it with having the amazing Joylene and being who y'all are, but just that no matter who takes it, like they're going to be able to speak to the questions, right? Like even some of our community partners who participate in SRSI, they were like, what is that? What does that mean?
Yeah. Exactly.
It was very technical. Although the people who facilitated it were dreamboats. Loved them. Just, it was very technical.
Yes, exactly. I think that's the other thing why we are attracted to this tool, because it does feel a lot more accessible to anybody to take it, right? I don't think we've figured out exactly who those 10 people will be yet. Again, that's something we can do probably collectively, but in my mind, it would be like, you got to have at least 2 people who are family members and 1 youth, and then 1 rep from all of the systems. And again, that's the minimum. If you want, as a region, to have more people take the survey, so you have more information, like we can definitely set that up in a way that still maintains the validity of that data at a state level. So I think all of those details are kind of yet to be flushed out. But yes, definitely hope youth and family will be participating in the survey. And I do hope that the tool is much more approachable in a way that the SRSI just was not for lots of people, myself included. I was like, I don't even know what this means.
I'm glad it wasn't just me.
No, that thing was, yeah, it was very hard to understand. Okay. Anything else on the survey? Okay, I think I just have a couple slides left. Okay, so Haley, you asked about the implementation plan. I do have like a Word document that I will be sending out that you can use as a template, but basically it'll be a table, like your budget allocation, how much do you want to put towards that category, the activities, description of what you're going to do with the money. If you know subgrantees, please let us know who they are. If not, that's fine. And then something around the objectives. So, by the end of this time period, this is what we hope we will have achieved with these dollars. And here's some examples of those objectives. So, by December 30th, 2027, we'll have increased membership in our youth advisory committee by 10 people. We're going to host 10 parent cafes every year with an average of 10 families at each cafe. We're going to serve 50 families with Agile funding by December of 27. We're going to gain 100 followers on our Instagram account by July. We're going to have 1 memorandum of understanding with our child welfare and county juvenile office. We're going to host 2 in-person collaboratives every year. By July, we're going to develop 1 aligned action plan to support implementation of the System of Care strategic plan. Again, smart, realistic, achievable, time-bound, kind of where do you hope you will get with the funding? Any questions about that? And I'm happy to kind of, as you start digging into your implementation plans, like, is this an objective? I don't know, like happy to talk with you about that. Or we could even talk about this at our April Learning Collaborative if you want. Okay. And then just a few little pieces about the 23 to 25 grant. So that grant ends December of 2025. Intent here is that all of your grant funding should be spent down by the end of the year. If you have concerns about being able to spend down the $200,000 by December, please reach out for technical assistance and let's make a plan. Question about your reporting requirements. So you have a quarterly report due April 30th. You have a quarterly report due July 30th. On the current reporting template, the July 30th report is like your final. I'm going to revise that. There's been some questions. Your final report for the 23 to 25 will be due January 31st. So that will start the 6-month reporting cycle. Okay, so that report will report back on what happens July through December, so the last 6 months of this year. That will also start the 6-month reporting cycle. So April 30th, July 30th, and then you don't have anything until January 31st, 26. And I'll make sure this is clear and consistent within the reporting templates. Any questions about that? Okay. Just like word of caution, right? That means like at SOCAC, we're not going to formally hear anything about your grant from June or July until January. We're going to have amendments. We're going to have a lot of things going on. So there'll be a lot of back and forth. But if you're coming to like October and you're like, shoot, we still have $100,000 that we're not, we haven't gotten out the door yet. Like, we'll have some conversation because it might change the way your amendment looks in terms of being able to get that funding. The best thing you can do is just get that funding, right? We want you have the money, like get that money out into communities. We know families need it today. And if you're having trouble for whatever reason, like we'll be in touch and handle it via the amendment. Um, okay. I think that might be all that I have. Oh, here's some resources, data resources. Um, if you haven't seen it, we also just released the System of Care Data Assessment. This is a brand new report that was brought to the System of Care Advisory Council last Tuesday. I'm just kind of waiting for just a couple of final edits, and then we'll be sharing that resource via Basecamp and on our website more formally, but there's a lot of great data in here. So definitely encourage you to take a look at that if you haven't already. Okay, end of my slides. What questions do you all have? Anything else you want to chat about in the space? Or feedback too. Love to hear your suggestions and ideas for making this easier, making it better. Nothing? Yes. Slides. I'll send you the slides. I'll send you the recording. I'll also send you the draft, like kind of implementation table document you can start working on for your amendment. Yeah. Does June 30th seem like reasonable? Does it feel like you can have meaningful conversations with the people you need to have conversations with by end of June?
Not for me, no.
No.
No, I wish there was more time. I wish it could be August.
August?
Mm-hmm.
Okay.
That's me personally, though, just thinking of how our structure works and how we have limited flexibility with having kind of meetings that involve family and youth, unless they're in kind of like our three structured meetings.
Yeah.
So.
Yeah. What's the vibe check on like June versus August?
August feels way better. I'm freaking out about June.
Are you? Okay.
I think the other perspective that I have, Christy, and this might be just unique to Yamhill County because where we are with our strategic plan, but we're sort of, wanting our strategic plan to inform our new grant implementation plan, or at least be reflected in what we want to do with the grant. But we're in this catch-22 of sort of holding off on the strategic plan so we can align it maybe with the state level plan or at least look at it. And so I think there's been a lot of back and forth at our committee of like, do we do the strategic plan first? Do we do the grant implementation plan first? And if we would have more time to look at our strategic plan if we had until August to make these decisions, I guess, is where I'm at as well.
Yeah, related to that, Amanda, because I think it's probably going to be hard for folks to specify what that strategic planning category is going to look like until you have the state plan. And so that way I'm kind of like, just like put it out there as a placeholder, right?
Sure,
like take your best guess. You can be kind of vague with the language, like we're going to develop an aligned implementation, right? And take a guess at the money, right? $5,000, let's say. And then you all know these dollars are really flexible. You can move things around, know. I don't know if that helps, Amanda, but if you want to, because you're just not going to have the information you all need.
Yeah.
Even by August, like you're still not going to have anything else.
Okay. Thank you. I still think August would be easier for us.
Yeah.
But,
yeah. I mean, the reality is SOCAC for the strategic planning timeline is going to see a draft plan in September. So we're retreating in July, we're drafting in August, and then publicly kind of getting community feedback on the draft plan in like September, October. So, you'll have a little bit more information in September, but by that point, I think it's too late to start on the grant amendments, just knowing how slowly OCMP Office of Contracts can work. So, but to be totally honest, like that June 30th deadline, I just kind of made that up. Just thinking about like summer schedules and grants review and kind of how long it takes. So at one point I did have an idea. I was like, well, maybe there can be like two deadlines. Like if you're the early bird and you want to get it in by June, like please do that. And if whatever you need more time and you need it, then like a second deadline of August or something. I'm totally open to that. I think it might make the review period a little bit more complicated for the grants committee, but I don't think it's insurmountable. And honestly, it might make it a little bit easier because it's, if I knew that half of you were going to submit in June and half were going to submit in August, but what I don't think we can have is like all 14 of you submitting in August because then we're going to be in a rush. Does that make sense? Love that you for So how about this? How about if you're like, Christy, like I'm really stressing about the June, like, can we get some flexibility on that? Why don't you just like reach out to me? And I mean, truthfully, like it's not like you're not going to get the money, right? I was just trying to kind of space out. Does that make sense, Roxanne?
Yeah, it
Okay.
definitely makes sense.
Okay.
Thank you.
Yeah. Okay. Are there any other pain points in this whole grant amendment that you all want to raise or try and problem solve on?
I think you've done a really nice job laying this out for us. So thanks for taking the time to share and create all of these slides. This helps, I think, clarify a lot of things for me and will be really helpful in being able to bring it to the local members.
Great. Thank you, Heather. Thanks for the feedback. Okay. Well, unless there are any other questions, we can wrap it up here. Please look for slides, materials, and yeah, really, if you have any questions, you're like, can I just talk through this with you for half an hour or whatever? Like, I love those phone calls. It's always really nice to connect with regional partners. So please don't hesitate at all. And yeah, look forward to sharing your great ideas with the grants committee. And yeah, I hope you all have an okay Monday. And we will see you next time. Bye, everybody.
Thank you.
Bye.
Thank
Bye.
you.
Thank you. Bye.
Bye.